In the deep dive tonight, senior investigator Lisa Fletcher has been exposing risks in America's drug supply chain and how our dependence on overseas manufacturing can lead to dangerous shortages for American patients.
And now her reporting takes her to Texas, where a pathway forward may lie in a Dallas parking lot.
Bryton Zastoupil shows his chemo port scar as a badge of honor from a battle that started when he thought he had a simple stomach bug.
They call us a little bit later, they say, go to Dallas Hospital immediately. Sure enough, the doctor comes back, you have leukemia.
His mom, Kristen, remembers trying to grasp the reality.
It was just a surreal moment. Like, it doesn't feel real. You almost think it's just a nightmare. Like, this is not true. This can't be happening. Not my kid. My kid's healthy and happy.
Bryton needed an extensive, carefully curated treatment routine that would go on for 3 years.
It would be 9 injections a week.
And I have to imagine it was painful.
Thankfully, there was numbing spray, which helped, but it did still hurt a lot, yes.
Though painful, his treatment roadmap was clear, until something the family never thought possible. The drugs he needed were in short supply.
When you went into Bryton's cancer treatment, did you know that shortages were a possibility?
Initially, no. Every 2 weeks, we were holding our breath that they were going to be able to get enough medication to treat him.
Often, those shortages are tied to our reliance on foreign manufacturers, creating a brittle supply chain that can break at any interruption. Take methotrexate, a backbone pediatric cancer treatment made at this manufacturing plant in India, Intus. In 2023, violations for safety there were so bad, characterized as a cascade of failure by the FDA, the operation was shut down. With it, much of the U.S. supply of methotrexate, needed by American cancer patients like Bryton. Studies confirmed the 2023 shortage compromised care due to forced treatment delays and shuttered clinical trials. Disruptions that experts warn can lead to patient deaths. An appalling reality that struck billionaire Mark Cuban, who was building an empire designed to make drugs here in the United States.
I can't think of anything worse for somebody to do with their company than to make it so it's harder and more expensive for a child to get their cancer medication. So we manufacture them.
So, here in Dallas, Texas,
And these are the tractor trailers.
Cuban's company, Cost Plus Drugs, is trying to fill the gap with flexible manufacturing in trailers with the ability to go anywhere.
How unusual is a place like this in the United States?
It's the only one like it, to my knowledge, not just in the United States, but in the world.
Cost Plus Drugs CEO Dr. Alex Oshmiansky gave us an inside look.
Everything here is sort of built from the ground up to be able to address drug shortages.
The equipment inside the trailer enables his team to make sterile injectable cancer drugs, switching what it can make to respond to shortages quickly, providing security for doctors and parents who've scrambled for doses. Today, after 3 years of treatment, Bryton is cancer-free. He's encouraged to see the push to move manufacturing here.
Having made directly in America, we know it'll pass the standards because they have to make it to those standards. That's what makes me feel better about having this whole market in America, so that way we can make sure everyone can get it how they need it.
All right, Lisa's joining us in studio now. And Lisa, we keep hearing about bringing back drug manufacturers to the United States. Is it really happening?
Not in any meaningful way yet. There's a lot of talk, but the economics still favor overseas production until you fix things like pricing pressure from middlemen and incentivize domestic production, which U.S. manufacturers tell us would include reducing or eliminating some huge FDA fees. It is unlikely that large-scale reshoring was going to happen anytime soon.
All right, so for families here in the DMV, what does this mean for them in the short term?
It means the risk isn't going away. Even top hospitals here in our area are still relying on a global supply chain that can break overnight. So when a plant overseas shuts down, doctors here, Scott, feel it almost immediately.
Yeah, and as we were talking about during the story, what a difficult position for people to be in as a result of all this.
Oh, it's impossible because doctors tell us there is no equal protocol generally. It's generally a second-tier protocol when one of the drugs runs out.
Yeah, really a lot to still figure out there. And Lisa has been digging into this for a very long time. And of course, if you want to catch these reports, very important to see. Our viewers can go right to WJLA.com and you can click on the iTeam tab to see the rest of them.